and welcome back to the Urology Care Podcast, the official podcast of the Urology Care Foundation. We have two fantastic guests with us to talk about men's sexual health. Our first guest, Dr. Denise Asafu-Adjei, is the Assistant Professor of Urology at Loyola University, where she serves as the Medical Director of Male Reproductive Medicine. She also holds a dual appointment at the Parkinson School of Health Sciences and Public Health. She's a strong advocate of equal healthcare access for all patients. Our second guest, Dr. Amarnath Rambhatla, is the Director of Men's Health at the Henry Ford Vattikuti Urology Institute. His specialty areas include male infertility, low testosterone, sexual dysfunction, Peyronie's disease, and vasectomy. So let's get started. We are here with Dr. Rambhatla and Dr. Asafu-Adjei to join us on a discussion about men's sexual health. I'll have both of you introduce yourselves. So Dr. Rambhatla, let's start with you.
Hi, my name is Amarnath Rambhatla, and I'm the Director of Men's Health at the Vattikuti Urology Institute at Henry Ford.
And I am Denise Asafu-Adjei. I am at Loyola University in Maywood, Illinois, outside of Chicago, and I'm the Director of Male Reproductive Medicine here.
Wonderful. Well, we are excited to have you both here with us, again, to talk about men's sexual health. So I first wanted to kind of start with the basics and talk about why is it important to even be talking about men's sexual health?
Men's sexual health it's important for a man's overall well-being, and sexual dysfunction can sometimes be a foreshadow of problems to come later in life. And for example, erectile dysfunction, especially in younger men, can sometimes manifest before other medical problems such as cardiac problems later in life. And so it's very important for us to be able to identify these issues early on so we can get men treated to help optimize their overall health status early on.
And I think to piggyback off of that a little bit, I also think when we talk about sexual health, we're talking about quality of life. I think oftentimes in medicine, we're often dealing with conditions like, cancer and, other things that are, of course, very important. But I do think that sexual health tends to get sideswiped a little bit as being sometimes less important than other aspects of health. Quality of life issues, as we know, there's a lot of men who don't even seek treatment for certain conditions because it can potentially affect their sexual health. Men who don't take certain medications for other important conditions like cardiac issues because it could, affect sexual health. So I do think that it's a really important area for us to focus on, because I think when people feel like their quality of life is optimized, it often does influence their behaviors with other, with other kind of health-seeking measures. So that's also a reason why I think it's really important for us to continuing leveraging those conversations.
Yeah, absolutely. You guys both made some really great points there. And so you kind of touched a little bit on some different conditions in those responses, but what are some of the most common urologic conditions regarding sexual health for men that you see in your practices?
Yeah, I mean, of course, I'll probably take the easy one away, erectile dysfunction. Which, we know is like the most common sexual dysfunction. I think probably something that a lot of people don't realize is that erectile dysfunction can affect men across the age spectrum. And so I often tell patients, this is not just a disease of, your dads and your grandpas. I'm sure, Dr. Rambhatla also sees, younger patients. I see really young patients who, again, this may be a harbinger of other medical conditions, but it's really common. And, I think people just don't really kind of recognize that. I'd probably say my top two, between that would also be, premature ejaculation is also something that I think in a culture where we constantly have this elevated view of what our sex life should be. I think a lot of people also come in with the notion of, should I be lasting this long? And what this should be. And so I think people's baselines are quite skewed because of that. So I'd say those are kind of my top two on the kind of sexual function side.
Yeah, absolutely. I mean, those are very common. Other things that we see Peyronie's disease, especially now. It seems like with better treatments for Peyronie's, people are becoming more aware of the disease process and coming in and seeking help. Other ejaculatory issues, delayed ejaculation, anejaculation. And I also see a lot of men with low libido, which may be a sign of erectile dysfunction, but also hormonal issues, such as low testosterone. And so that's also something that we commonly see.
I think it's also so interesting, and I think I'd also be curious to hear your thoughts. I feel like I see a lot more men now who are just like, oh, I don't feel like myself, and a lot more people are a little bit more sensitized to, well, I think it must be my testosterone, right? Like I just feel like there has been this shift in that more men have become aware of this could be a contributor for the low libido, for the low energy. So I feel like that's become a little bit more mainstream. Are you seeing that as well in kind of your practice?
Yeah, absolutely. And so, and this whole low testosterone, it's a very real condition. But oftentimes we see that people aren't being properly diagnosed and properly treated. And so I think, it's something that we can't just overlook. And I think patients need to be aware of this and come in, get the appropriate workup, because, it's testosterone is very important to not just sexual health, but other organ systems in the body. And it's important for mental well-being, for, musculoskeletal health. And so there's a lot of systems that testosterone can affect.
Yeah, I wanted to go a little bit deeper into that. I mean, that's definitely, I feel like something you see a lot more like on social media and people talking about testosterone. So can you dive a little bit more deeper into what it is, why it's so important, and how it contributes to men's sexual health, and why talking to a doctor, and Dr. Rambhatla, like you said, getting the test and making sure that you're getting the right information, why that is so beneficial.
Yeah, so testosterone is basically a hormone that's secreted by the testicles, and its main function is to help develop male secondary sex characteristics. And it's also important for other organ systems, like there's testosterone receptors in the brain, in the kidney, in skeletal muscle and bone. And so it's important throughout the body. And even women have a low level of circulating testosterone that's made by a different gland called the adrenal gland. And so it's important for both men and women, but certainly in men, as you get older, testosterone levels tend to decrease. And, we have very good studies that show that, there's a decline, but there can be a significant decline in some men to the point where they start exhibiting symptoms of having low testosterone. And, these can manifest as problems with sexual function, low libido, fatigue, loss of energy, trouble sleeping, memory function. It could affect mental well-being. And so, it's important for men experiencing symptoms like this to come in, be properly evaluated, because there are very effective treatments for this. And, testosterone replacement therapy can help improve a lot of this function and restore quality of life. And it's not something that you have to live with this decline in quality of life.
And I think you also brought up a good point where it's a medical condition that we treat. I think it really has, unfortunately, become quite a predatory market with people not properly diagnosing it, inappropriately overtreating people. And there are real side effects from taking things like testosterone, which is why you want to be under the care of a urologist or someone who has the medical training to manage this, so that you can get treated, that you're getting treated appropriately. So I know that a lot of us really advocate for, if you're feeling like you have these symptoms, try to get under the care of an actual medical provider who can really guide your treatment appropriately.
Yeah, absolutely. And, it's important. Testosterone therapies can have side effects also that need to be monitored. And so, it's especially important to be getting appropriate care for that as well.
Yeah, that's something that we always advocate from the Urology Care Foundation is, always talk to your doctor about, starting different therapies or supplements or medications is always the, best course of action. So something that you guys talked about a little bit earlier in terms of different things that your patients were saying when they were coming in to the office, they're talking about quality of life, they might be not performing as well as they would like, or they kind of feel off, or they have these symptoms. So what are some of those common things that you see when a patient comes in that may bring them to a urologist?
I'm always happy when people make their way to us because I think that, by the time they get to a urologist, you probably know that they've done their research or that things can be quite, bad. We know that men historically don't seek out healthcare as women do. And so by the time they get to see a urologist, hopefully a great PCP would have referred them, or if they're just doing some research and they come across some of the symptoms, local urologists may come up. I think some of the most common things that certainly drive men into my office are changes in sexual function and performance and energy levels and just not feeling like themselves. And I sometimes feel like you have on the one end of the spectrum, men who that change has just happened and they're just like, I have to get ahead of this, or someone who's like, it's been 5 years, my family's about to put me out of the house, so I need to come and seek
Right.
come and seek care. And I think with platforms and, resources like the Urology Care Foundation, people are recognizing signs and symptoms that should drive them to see us earlier. But those are some common ones for me. And then as you're talking to them, more things come out, and then you're kind of dealing with some other associated issues as well.
Yeah, I think you hit it right on the head. It's hard to get men to go in and see the doctor, right? So, I hate going to the doctor myself, even though I know how important it is. Like my wife has to literally make the appointment and almost drive me over to get my regular checkups also. But, I think that's the hardest step, is getting them in the office. Once they're there, then they start talking and opening up, and all these issues start to come in. And, other common issues we hear about, penile curvatures, decreased sexual desire, fatigue, pain with erections, problems getting and maintaining erections. So these are all symptoms of sexual dysfunction. And, but we do have good treatments for these. And so I think, the biggest part of the battle is getting into the doctor's office.
Yeah, and so, we kind of touched on why it's important for men to go, see their doctor, see a urologist, get their symptoms checked out. Are there some times that these sexual health issues or symptoms that a man may be experiencing, they come in to see a urologist? Can those sometimes be underlying factors for other larger medical conditions? Have either of you seen that in your practice as well?
Yeah, I mean, I could certainly speak to on the ED side, and I know we both see this. We know that erectile dysfunction is a marker of cardiovascular disease. So oftentimes, for the man who hasn't been to the doctor in 10 to 20 years, by the time they come in, we know at the very least that they have some other vascular issue that is arguably a much larger issue and more important, some would say, for them to treat and address. And that even for us is in our guidelines for treatment to talk about cardiovascular disease when we see men with erectile dysfunction. So I know oftentimes, urologists really try to get men tapped into a primary care physician to better manage some of these issues. But that is really, really common. And I do find that once you drive home that this is really a symptom of other, larger system, diseases, sometimes you can get men to listen a little bit more about why their health is important.
Yeah, absolutely. I mean, I think that's, the biggest one. I mean, linking erectile dysfunction to cardiovascular risk. But, I mean, other conditions like Peyronie's may be associated with like Dupuytren's contractures, where men get contractures in their hands, which limits mobility. A lot of the sexual dysfunction that we see may be related to issues like low testosterone or other systemic endocrine abnormalities. And so, there are underlying systemic medical illnesses that sexual dysfunction may be a symptom of, and it's important to kind of put together and see what the bigger picture is and assess overall health. And so it's really important for urologists to also work closely with primary care providers in this setting.
So are there some things in a man's life, like his lifestyle? Are there elements there that could be contributing to some of these symptoms or conditions? Or is it something that's more genetic, or that it's just really common as you get older? Can you talk about that a little bit?
Absolutely, lifestyle and matters, but genetics probably matters also. So, but keeping it, you can control what you can control, and you can't really control what you've inherited from your parents, but you can control your lifestyle. And we know that a healthy diet, not a regular exercise, not smoking, and not drinking excessively are all associated with good outcomes in terms of sexual health and overall health. And so it's really important to, be able to control what you can. And so leading an active lifestyle is very important in this sense.
So I want to dive a little bit into the infertility realm. I know infertility is something that you hear a lot about when it comes to women. But we know that it also affects men as well. So I wanted to have you both kind of talk about why you think that there is more of a stigma around infertility when it comes to men, and how we can bring more awareness so men feel more comfortable, getting checked out and talking about it.
Yeah. And thank you so much for bringing this topic. I mean, I think for those of us that treat sexual dysfunction, a fair amount of us are also, trained and manage, male infertility. And I think as a society, and this is not just in the US, I'd say really around the world, I think that society is more sensitized around fertility issues being attributable to the woman. For a lot of young women, we start seeing our, gynecologists fairly early on. I think we're a little bit more aware of our body and, kind of this process of mothering potentially at some point in our lives. And I think that it really has become it has been a lot more taboo for men to feel like they can't contribute to having, their own family. And I think that's really across the board, across really all cultures that I've seen. And I think it really hasn't been until like the last maybe 20 years that people are starting to have more honest conversations about, male factor infertility. But it's important, men actually have some role in about 50% of infertility cases. So it's a big issue. And I think that women have unfortunately been unfairly stigmatized around issues pertaining to this. But I'm confident and I'm optimistic that the tide is shifting. More and more men are becoming aware that they can have a role in this. And I think for couples who are trying to have and expand their families, I think they are better engaging. From a numbers standpoint, there are a lot less of us compared to our colleagues on the female fertility side. So that also adds to, kind of access issues. But I think, we are pushing awareness, and I think it is getting better.
I think, as you're saying, women have largely been taking the responsibility for this because they're responsible for carrying the baby and delivering the baby through pregnancy. And oftentimes they're the first ones to show up in a doctor's office when a couple is having fertility problems. But, 50% of couples' infertility can be related to a male factor. And so what we need to do as a society is educate patients and men and bring awareness to this. And really, men need to be having a workup when couples are having fertility problems as well.
Yeah, well, I hope this podcast and, the work that both of you are doing, among, many, many other doctors, help push out that information and make it more known and make it more common to talk about, and encourages people to, talk to their doctor about any issues they're experiencing. So kind of going into, the awareness and, encouraging men to go to the doctor. What do you think the biggest challenge is for men regarding their sexual health and getting help for it?
I think the biggest challenge is actually just getting them in to go see the doctor, right? So, once they're there, I think it becomes a lot easier. One, it's hard to get men to get in to see the doctor, and then also get them in to see a doctor who's comfortable discussing these issues also, because a lot of doctors will probably admit that, based on various cultural or societal norms, they have a hard time discussing sexual health with their patients, and may just skim over it. So really, a referral to a urologist who specializes in sexual health, I think, is very appropriate if men, show that they want to speak about their issues a little bit more.
I also think awareness in education is a barrier to, men seeking out health. I think, with sexual functioning being so tied to masculinity and, and other things, I think it's almost like coming to the doctor is like this realization that, something is off. And I think the more and more that we spread education, like platforms like this, men know that it's not just me. A lot of men are really surprised, a 50-year-old man, where I'm like, half of your friends have this issue, at least half, right? I'm like, they're just not talking to you about it. And so I think when you really kind of level that playing field, and it's like, oh, it's not just me. I feel like a lot of people suffer in silence. And I think the more and more we do talk about it, we destigmatize, we get them to come and talk to us, and we can, address their issue, which, as we've mentioned several times before in this, kind of this setting, it's linked to a lot of other medical issues. So it's not just, oh, you should come in because like this is just, like a flippant, quality of life. It's important. And I think that's something that's been helpful in, getting guys in to seek care.
It's not something discussed at the family picnic.
No, not at all.
Yeah, so I guess that kind of, transitions into the next element of, helping men feel empowered to seek support, having people in their life support them. If a man is in a relationship and, his partner's encouraging him, or, they're starting to have these conversations, how can those partners, help support the men in their life to, seek help if they're expressing, these symptoms or the issues in a way that, would help encourage them to seek support? Do you have any advice or guidance on how those conversations could look?
Yeah, I mean, I can certainly probably speak on the, the partner side. I think that's so essential for men to feel like they can come and seek care from us. I think it's always great when, couples come in together and really see it as like a joint problem. And I think it does, allow for kind of less shame and embarrassment around the issue. So I think partner support, there's been, actually several studies that have looked at the impact on partners when, the man is suffering from sexual health issues. So it really is something that has like a domino effect. So, I would say if you see your partner suffering, and if he perhaps is not as willing to go into, the doctor's office, and you're watching this, hopefully start the conversation. Of course, partners often know when you have a problem, so it's not a secret, but I think oftentimes it's that shame and embarrassment. So if you really just put out there that you are here to support, but also advocating for yourself that, it's also affecting you. I think that's a great way to get buy-in and to build, even a stronger partnership around this issue. So come in with your partners if you can. And I think we've seen really good outcomes when men feel like, their partners are in it with them and they feel that support.
Yeah, absolutely. I mean, I can't, count how many times a patient started off and said, like, doc, this is so embarrassing to talk about, but, and so I think that, the embarrassment issue is very real, and partners, if they can support them and, be there with them, I think goes a long way.
Yeah, and I think something that you both had talked about was, that a lot of these conditions that men face are so common, like erectile dysfunction, that, that it is, something that a lot of men experience, that there are treatments to help, that their doctor can help them with, and it, really can improve their quality of life. So I think, like both of you said, starting those conversations, finding a doctor that you're comfortable with to talk about, and knowing it may be a little awkward, but that's okay. Everything in life is a little awkward now and then. So kind of going into, men's health, men's sexual health in general, is there anything that either of you are seeing from, like a medical side, that's kind of up and coming in the men's sexual health space?
Oh, good question. Well, lots of things on the internet for sure, but hopefully you could still see
How many of those are real?
Exactly. Watch out. I mean, it certainly is a space that I think is vast with new technologies and advancements. I mean, there's like firmware, things to help measure like the strength of your erections. There's stem cell research, to see if that can help replace some of your penile tissues. And, I think in the next decade, we're going to see some really cool things on the market, but certainly not everything is created equal, what's on the market now. So I always really do try to caution my patients against, what you're finding out, what you're taking, and just making sure again that you're doing this in guidance with a medical professional.
Yeah, I mean, it's an exciting time. There's a lot of things, coming down the pipeline that, could potentially reverse, erectile dysfunction with some of these therapies that are known as regenerative therapies. And so I think you just have to, make sure you're under the care of a licensed doctor and getting the appropriate care, because we do see, some questionable things being done. So.
Yeah. A lot of snake oil out here.
Yeah, I definitely think it's always good for, patients to, do their own research, learn as much as they can to be aware. But again, it seems, it's always best to talk to a doctor about what they're finding. You guys are the experts. So, do your own research, but take it with caution and talk to your doctor is always best. So as we kind of come to a close, I wanted to have both of you, give some advice that you have for others in terms of men's sexual health. And Dr. Rambhatla, let's start with you.
It's something that's very important to quality of life, and it's having problems with sexual health is something that's very common. You're not alone in this, and it's just something that most of your friends and family members aren't talking about. But it's about 50% of men above the age of 40 to 50 have some degree of sexual dysfunction. And so, I think if you're experiencing any of these symptoms that we've talked about, get in to see your primary care doctor as a first step, but certainly they can refer you to a urologist who specializes in things like this. And there's very good treatments, and it's good at restoring quality of life, but can also help identify other more serious systemic problems that may be occurring as well. And so, for that reason, it's also very important to get in and see your physician.
And I guess my parting words would be, sexual health is health. I hope that, really after hearing our conversation and this discussion, that all the men and partners feel empowered to, seek out help if your sexual health is affected. In my mind, quality of life and sexual health should be just as important as you seeking out care for your cancer screening and, anything else is important. And I think we have to continue to validate that this is something that has to be elevated in conversation because it touches on so many different components of your life. I think that, there is help out there with good professionals who understand this, who want to help. And I think resources like Urology Care Foundation, our American Urological Association, you can find urologists in your area if you really want to, discuss this, but we are here to help. And I hope that, this is productive and informative for you.
Wonderful. Really great advice from both of you. I'm so happy that we were able to have this discussion. I hope other people find it, incredibly helpful and informative, and encourages them to start the conversations and, see their doctor to talk about whatever, may be bothering them. So again, thank you both so much for joining us on today's episode of the Urology Care Podcast.
Thank you so much. Thanks for having me.
This podcast has been brought to you by the Urology Care Foundation, powered by trusted experts of the American Urological Association. For more information on today's topic and for all things urology health, visit urologyhealth.org. That's urologyhealth.org.